The greatest challenge of reproductive medicine in the new millennium is meeting the expectation of women whose fertility is age-affected. Quite reasonably, women who has remained fit and healthy through looking after herself by avoiding smoking, excessive alcohol consumption, and has a normal BMI might expect that her fertility would be higher than someone who hadn't done that well. However, the most important prognostic factor for fertility is still the age. Most women know that their egg supply gradually runs out towards the time of menopause. But most don't know that despite regular ovulation for the 10 years leading up to menopause, these monthly ovulations are profoundly subfertile. When pregnancy does happen during these years, the risk of miscarriage is sadly so much higher than in the earlier years. There is a reason for this. Not only there is fewer eggs remaining on the ovaries, but the vital chromosomes in the eggs mostly of wrong number when it receives the fertilizing sperm. We know women in their 40s are most likely or more likely to have a baby with Down syndrome due to there being an extra copy of chromosome 21. This is called trisomy 21. That's one of the common trisomies that happen in advanced maternal age, while there are so many others that are not compatible with life. So when the eggs make one mistake, let alone multiple mistakes in the chromosome count, fertilization and early embryo development often happens, but it won't develop to a detectable pregnancy. So the visible outcome is infertility or failure to conceive. The same happens in IVF, but we can see the embryo stop developing in the lab, which is hidden from us in the natural process. So how could IVF improve fertility chances in later reproductive years? The answer is, if you make enough eggs in response to ovarian stimulation hormones, and if few of them develop to an advanced embryo stage, we can then take small number of cells out of these embryos and test the chromosomes for abnormalities. The embryos are frozen while the test being carried out, and normal ones may be transferred in a month ahead. This is not only going to increase the chance of pregnancy, but this would dramatically reduce the risk of miscarriages. However, not everyone will respond well making enough eggs for this to be a useful process for them. AMH, a blood test, can reasonably accurately predict the response of ovarian stimulation and can be useful in planning an IVF cycle. However, AMH should not be used to discriminate older women against treatment. It is a question every woman asks: is there any medications that she can take to improve her egg quality? While there is no such magic pill that can completely reverse the age effect of fertility, certain medications could improve the protein spindle within the eggs so that they may function better. Finally, although it isn't any woman's first choice, egg donation from a younger woman, either locally or overseas, can often make the difference between having a family or not. This is something we can definitely give you a helping hand to make it a practical reality.